the first thing before getting into the checklist as such, the first thing I would like to know is, how long should the preconception period be, or by when should you decide, like, I want to have a baby? Like, is it like 6 months of preconception time is required, or 1 year? Like, how does it work? How long should you be preparing for a baby?
See, now actually, if you see the age of marriage as such is like pushed like way beyond. So probably 10 years or 20 years back, probably everyone used to get married by the age of 25. But now it's hitting 30, 35. So, I mean, and it does make sense because everybody wants to be more, independent and financially secure rather than just getting married and, getting pregnant without any backup.
Yeah.
So what I would say, any patient, in fact, who is less than 30 years of age, they can wait for up to 1 year.
Everyone said, yeah.
Yeah. They can wait for up to 1 year to try naturally. That is, less than 30 years of age is fine. Even 30 to 35 also, depending on whether all your parameters are normal, your cycles are regular, how your ovarian health is, or how the male partner's health is. Depending on that, we can wait for maximum up to 1 year. 12 cycles, that is, because every cycle, your chance of getting pregnant is hardly 10 to 12% that way. That's why we say in 12 months, 1 month it may click. Some people are very lucky, they get pregnant the next month itself, but then not everyone is that, right? So after 35 years of age, we would always consider that, the best part is to try for 6 months. If it doesn't work, get help as soon as possible.
Okay. Got it. So this applies to everyone, irrespective of, like, if they have PCOS or like thyroid or whatever. This applies to any common population. So yeah, age is generally one factor you are telling me.
Age is the main factor for females because our eggs are as old as we are. So the thing about males is, like, each time they ejaculate, the DNA is new. But for females, we are born with that number of eggs, and we are born with the quality that will keep degrading every year as we are growing older. So that's why patients who are younger, even if they have PCO, thyroid, whatever it is, 25 years and lesser, have very high chances of pregnancy spontaneously. As we age older, things get a little more difficult. It's not that it's not possible, but you need help. But the problem is people take a very long time to come for help. So nowadays we're seeing girls, women who are coming at the age of 30, 32 with a very low ovarian reserve. Now that is something which is really bad, and you cannot predict it until unless they have actual symptoms like decreased flow, or the menstrual flow also is like very less on their usual menstrual periods. The flow is less, the number of days is less. So these kind of things can give you an idea that maybe I should check my ovarian, quality. Because if your AMH value, that is what we do, the test we do to check your ovarian quality, if that is less, and then you go even for an IVF or anything like that, your chances of success are very less. And nowadays we're seeing patients like 20, 26-year-olds, 30-year-olds going into this premature menopause, which is really very scary.
Oh, wow. I'm actually scared. Thank you. All right. So that's clear a lot of things. Now let's, I do have a few questions on this. I'll ask you a little later. Let's get into the main question that we have, right? What are the fertility checklists that we have to get done before you are getting into pregnancy per se? Like, even with nutrition, I have my own things that I ask them to get done before getting pregnant. So from a doctor's point of view, I would like to know how that works. Let's start with a woman, right? So what all should she get checked, before deciding to have a baby?
See, there are so many tests out in the market, and now if you go to any lab, everybody have this package. So they have a fertility package, a pre-baby package, a to-conceive package. So it's just that if you want to get it done, it's up to you. You can get it done. But the basic tests that we require, one is to know your blood group, to know your hemoglobin, then to know your thyroid status, your diabetic status, and probably in case if your BP is high or you have a family history of hypertension, we would also like to know how your cholesterol value, your lipid profile is, your cholesterol values. Those are the basic things. So apart from that, test required if, like, you have any family history or anything at all which suggests that you need a renal profile or a liver profile done, you can get that done. So these are the basic tests that we usually do for everyone who comes in. And an ultrasound abdomen and scan is very important. Now, when patients go, they might only get an ultrasound pelvis done. When you do an ultrasound pelvis, what happens is you're just assessing your ovaries and your uterus. And then after they get pregnant, probably after like a month or so, they realize that they have gallstones, and that can be a problem. So that is why doing an ultrasound abdomen as well as pelvis is very important before you all are planning for a pregnancy. So in case if there's a renal stone or gallbladder stones, or you have an appendix problem or something which you've never known before, will definitely get detected, and you can plan accordingly, rather than suddenly getting a kind of emergency in the middle of your pregnancy. That's even worse.
Right, got it. Is there any other, like, this does include a lot of blood parameters, right? Is there any other stuffs like getting tested for STIs, or, just knowing, as you said, like how your ovarian reserves are, like in PCOS, we get tested for LH and those things like thyroid hormones and all those things, right? So
like
does that work here as well?
If you go to any infertility center, okay, like a proper infertility center, they have a panel of tests, which definitely includes all these parameters too. That is, your serology is very important, because what they are going to do some kind of invasive procedure, which needs all these parameters. But if a patient who generally comes to me just for a first visit, just to say that I'm planning a pregnancy, how do I go about it? Like I said, these 4-5 parameters are more than enough.
Okay.
It's only when, okay, fine, that, or if they have a history of they've not done an HIV test at all in their life, like over 3 to 5 years of gap, then yes, they should be getting it done.
Okay, so it's not mandatory for everyone. It depends on where they come from.
Yes.
Right, got it. Okay, now that let's take the men in this criteria, right? So it's usually we just look into the women to know what are her issues, and get her checked, and that's done first always, and then only the importance is given to a man. So when it comes to men, first of all, how much are they affecting this as well? Like, it's a 50-50 is what I think, like definitely equal partnership here. And second thing, what are all the tests that they need to get done? And like, if someone comes to you, do you make sure that both of them get checked? Like, just want to know how it works.
See, like, if any couple walks in, whoever it is, irrespective of their age, or usually couples who walk in come when they are not able to conceive for more than 6 months or 1 year. That's when they actually come to the doctor. Otherwise, they try. Maximum they try for 1 year. But when they come to the doctor, we definitely counsel both. At least nowadays, every gynecologist definitely says that only if your husband gets tested can we go forward. Because there's no point in simply giving her medication, getting her scans done, and at the end of it, if there's something wrong with his semen analysis, there's absolutely no point. So only if both of them get it done. And for the men, the major test to be done is a semen analysis. So this has to be done between 3 to 5 days of the last time that they've had sex. So 3 to 5 days of abstinence, and then they give their semen. Now, the thing with most of them is they just go get it done in any lab, which again is wrong, because the report that comes is very basic. There is no actual correlation to what is actually right. So we have something known as a WHO criteria, which has to, be correlated with. So when you get your semen analysis done in a good fertility lab, it will exactly tell us everything that we need to know about. So semen analysis doesn't mean only the count is good. Now I've seen people with 100 million count but zero motility. So that it doesn't actually it will not cause a pregnancy. Very rarely, or if they're very lucky, it might. But with zero motility, it's not going to be of any value. And these kind of things are not mentioned at all in certain reports. That is why get it done in a proper WHO, criteria lab, especially infertility labs. They will give you a good report, so by which we can actually assess and tell you how to go forward. Apart from this, like you said, the serology tests are important for men. Anyways, when they do check the semen, they will check for serology also. And apart from that, because nowadays lifestyle changes, even men, like how women are getting affected by PCO, men are getting more closer towards the cardiac illness side. So they're developing hypertension, and very early, like 30, 35-year-old men actually have hypertension. And this can, we don't know how long it's been diabetes, thyroid problems. So all these things also have to be screened for men. Not that this directly affects your fertility, but then it has to be done because, it's overall wellness. And on top of that, if they are diabetic, again, the quality of sperms can get affected. All these things actually have to be kept in mind.
Got it. Okay, that's clear up a lot. So off the top of my head, like when when I get a person who's trying to conceive, the first thing that she says is the doctor told me to reduce 20 kgs in 2 months, 3 months. It's a very common thing I get to hear, right?
I think patients are, they get angry with doctors when they say that. But see, I know that it's not like every doctor can tell you in a way that, that, see, this is important for your health. It's not just about, and it's not easy to lose weight, especially in patients with PCO, thyroid problems. It's very easy to say, but then it's a struggle. It's a mental, physical, total overall struggle to lose even that 1 kg of weight. So when suddenly someone says, no, lose 20 kgs and then come back after 2, 3 months or something, it doesn't make sense. And patients actually say that, no, doctor, I'll lose weight and then get pregnant. There is no guarantee that after you lose weight, you'll get pregnant. Right. So what I tell them is like, see, like Yuli is doing a very good job in that actually by, telling patients how to go forward. So you can follow the right nutritional advice, the right kind of diet and exercise. At the same time, you try for a conception. If it happens, well and good. If it doesn't, at least you're going in the right way and you're actually causing your body, you're preparing your body for a pregnancy. Yeah, so there's no major thing that, yes, you lose weight and then come. So patients should understand why we ask you all to lose weight is that because the amount of adipose tissue that you have in your body is the source of all these hormonal problems, testosterone, all the things that are causing these problems. So once it comes down, especially the abdominal fat, your insulin resistance also gets down, you'll ovulate better, your chances of pregnancy will become better. That's how it actually helps in conception.
Yeah. So another trend that I see in this aspect is trying to lose weight by all the fad kind of diets, like do a keto or this and that, and try to lose weight. And then like I'll try for pregnancy now, but by which time their lipid profiles are off the roof, their thyroid is acting up, hormone levels are acting up. Yeah, I'll do that. Yeah, everything starts acting up and things like that. So where do you think the communication lacks in understanding this is what is required out of this person when they're coming to conceive? Because we get people like I have had 2 to 3 miscarriages after trying so much of like treatment again. Now I'm taking a 6-month break. In this break I'll lose my weight, then I'll go back and try it. Does it work like that?
No, it doesn't work like that. So one big thing is that I feel social media as such, that is your YouTube and Facebook and Instagram and whatever it is. So there are so many accounts of people who are promoting these things without a scientific basis.
Right.
So they're like, go for keto. Yeah, you will definitely lose weight. I'm not saying no, but again, when you're on a keto diet, then amount of ketone bodies in your body is high. And if you get pregnant by chance, again, that's going to lead to something detrimental. It's not going to cause something like a healthy pregnancy to grow. So these kind of things people are not understanding. They're like, okay, fine, I'll lose the weight, get pregnant later. But what I'm saying is you start your journey of weight loss, you start eating well, your lifestyle modifications, do all that and let it happen over a course. Don't go for these fad diets because all these are very short-term goals. So for that 6 weeks or 8 weeks, you will lose weight, you will feel great. You'll be like, okay, now's the time. But then the damage that has to be done to your body on a cellular level is already done. Now to get back the same thing again will take 2 to 3 months. So you're just messing up your whole hormonal system again.
Yeah.
So don't go for these fat diets. Meet a proper nutritionist. Get your diet. Get your workouts. What you can do, like some people also go to the gym and they start overworking out and losing 3 to 4 kgs over like 2 weeks, which is again totally wrong because you're losing muscle mass. You're losing a lot of important nutrients also that you have in your body through this overworking. So just know what you need to do with the right guidance, and then that should be fine.
Yeah. Thank you for that. And one more thing, does this weight factor apply to men as well? Like, are they also said to lose weight and like,
yes.
and does that affect their, fertility as well?
Definitely. Even that does actually. Okay, because one, overweight men actually have low libido. Okay, and then the second part is that yes, if they are overweight, they will have some kind of insulin resistance. They will have some kind of higher sugar levels fluctuations. Again, it affects the quality of the sperm. Now, even though the sperms are in millions, all we need for a pregnancy is just one sperm. Right. So if that one sperm which joins the egg is not a healthy sperm, it'll obviously lead to something like an abnormal pregnancy or an early miscarriage. So these things, like even smoking, drinking, their habits that they're doing, any kind of drugs that they're taking, all these influence the quality of sperm.
Right. So for them also it matters.
Definitely, definitely.
Right, got it. So now let's say, be it man or woman, if they come with a thyroid disorder specifically, does a test that needs to be done before fertility change? Like, is there anything special? Like, you need to get your thyroid on track before getting pregnant. Does it fall in that?
Yes. For hypothyroidism, we want your thyroid stimulating hormone, that is your TSH levels, to at least be less than 2.5 when you're planning a pregnancy. Like, see, for a non-pregnant person or a person who doesn't want, who's just, not planning, your thyroid levels even can probably up to 6 also will be okay. We'll be like, okay, let's change your diet, let's get everything down, and let's try to get it down below the 5.5 mark. But it's fine. But when you're planning a pregnancy, you should understand that your body requires that thyroxine. So when you substitute the thyroxine, it will help you conceive. Plus, when the conception happens, because when the baby is developing, the thyroid hormone, the thyroid functioning of the baby is delayed up to almost 5th month. So the baby has no thyroid for the baby self. So you are going to supplement that. So if your levels itself is not regularized, then how is that going to affect the baby? And thyroid doesn't mean, some people have this thing that thyroid hormone works on thyroid. It's not like that. Your thyroid hormone is very important for every function of your body, from your skin to your heart to your muscles, everything. So only when that is in track can you actually go ahead healthily. And for trying a pregnancy, definitely it should be within the values.
Got it. Okay, so that's a huge deal breaker there. All right. Now like for both the fertility tests or whatever, other than that, does nutritional deficiencies are also something that needs to be checked before trying for a pregnancy? Because it's very difficult to convince someone to do those tests.
Yes.
And does it have a role? Because once we see the numbers, it's easier to handle things in the back end, basically, right?
Correct.
So does it also have a role when it comes to fertility, to know how your nutrition profile is?
See, the thing is that the tests are a little costly.
Yeah.
So, especially vitamin B profiles are a little on the costly range. Not that everybody can get it done. Like people who want to get it done, definitely they can get it done. But otherwise, if I tell a patient who comes in for a pregnancy, let's check your nutritional levels, they'll be like, this doctor wants to make money. So by the time I try to make them understand, it's not going to work. So what I do is that I make sure that I give them vitamin D, because almost every Indian is vitamin D deficient. And there's no harm in taking vitamin D for 4 weeks. It's a weekly once tablet. That's it. So if you're going to take it, and that's one way which you can see. Another one is that if they actually have problems like muscle cramping, or they're very tired all the time, a lot of hair fall, the skin changes, and if you really feel that something is wrong, you can give the patient the option. But again, it's totally up to them to do the test or not. But like you said, the numbers can definitely correlate, and we can give them the right treatment, which will definitely help. And it's basically my macro as well as micronutrients are very important for overall functioning of every organ, and that comes with your reproductive system also. So yes, if you treat whatever has to be done properly in this section also, it will be good for the patient.
Thank you, doctor. I think the people are getting a little impatient. Let's answer some questions now. So first question we have is from Shreya, who has asked, do we also need to get on track for vitamin deficiency before pregnancy?
Yeah, this is what you said. Yes.
So the answer is yes, that does definitely help, I guess. Megha has asked, does high TSH in men affect sperm quality and eventually the pregnancy as well? Like just if the man has higher TSH.
Yeah, again, hypothyroidism can affect even the reproductive functioning. So it is better that he gets it corrected, and then you go forward.
Right. So when you told me about like a women having a hypothyroid and the child wanting the thyroxine, so it becomes a little bit of a difficulty there. That issue does not come with a man.
No.
For him, it's just
he just has to regularize his thyroid levels to normal. And after, it's not that, I'm not saying that every hypothyroid man has abnormal sperms. Absolutely not.
Right.
They might have a completely normal sperm semen analysis, and, it doesn't even matter. But I'm saying that on a majority, hypothyroidism can cause some certain problems in the semen analysis, not for everybody, but that should be tackled on to just make sure that he's healthy overall.
Yes. Pooja has asked, does home pregnancy test show how accurate results for a PCOS person?
See, if your periods are regular, even if you are a patient with PCO, and you've missed your cycle by 1 week, a urine pregnancy test done at home is pretty reliable. Until unless if you're a person with very irregular cycles and you are very doubtful whether and very light faint line comes, then I don't trust the kit a lot. If
Right.
two lines come which are pretty dark, and if you want to repeat, because patients buy 2 3 different brands and check them. So if you want to do that, it's up to you. But if you're really concerned about it, a beta HCG blood test will definitely tell you whether you're pregnant or not. And you can get it done in any lab these days.
Got it. I hope that answers your question, Pooja. Prati has asked, what is premature menopause and how to detect it? Even I
Yeah.
want to know that.
See, premature menopause is basically you're hitting menopause at a much earlier stage than what you're supposed to. So now, normally for women up to 45 to 50 years is when we see a menopausal change. That means your eggs are getting older, the ovary starts producing lesser of them, they start becoming dormant, they don't function. So all your hormones, especially estrogen, progesterone hormones on the body, they come down. That's when patients get into this menopausal stage. And if your periods stop for over 1 year, so you are at menopause. So premature menopause usually happens before the age of 35. So in these cases, what happens is that patients have very less flow during their cycles, or they don't get their periods regularly. And not only that, like, see, we can get confused by hypothyroidism, polycystic ovaries, or this. But when we do a scan, on a scan, we can actually see only 1 or 2 follicles in the ovaries. And then we'll be like, okay, this she probably is a candidate who could have this. And we immediately get an AMH done. So when we do an AMH test, we get to know exactly what her value is. Along with that, an a follicle stimulating hormone, as well as your serum estradiol, will definitely tell us whether you are in this category or not.
Got it. Okay. I hope that answers your question, Prachi. That was a really good question and it's very insightful. I have one more question. How to track ovulation in a short but regular cycle, like 18 to 21 day cycle? In those cases, how do you track ovulation?
Okay. See, usually in a 30-day cycle, we divide it into 10, 10, 10 days. Same way, if it's an 18 or 21-day cycle, you divide it by 3. So yours is 7 days. So your first 7 days is your follicular phase where the egg starts growing. The middle 7 days is your ovulation period. And the last 7 days is the time which decides whether either you're going to get pregnant or it's going to get prepared for if a fertilization doesn't happen, you will get your cycle by the next 7 days. That way. So see, the thing with ovulation is just that we give an ovulation period of a week. So ovulation can happen at any point of time. So only when we do a scan can we know whether it will happen in a day or in 2 days, but the exact time of ovulation cannot be found.
Right. So does this work for I do have few people who have 60-day cycle or like 2 month cycle, right? Basically, they get it properly, but every 2 months.
No,
In those cases, it doesn't work like this.
It doesn't work. That is a 60-day cycle. That's a long cycle. So that we don't know why it's taking that long. So within 45 days should be fine. Yeah, even shorter cycles up to 21 days are fine, but lesser or more than that is
definitely.
Yeah.
Got it. Harshita is asking, can we take vitamin D3 tablet without getting it tested? I heard from a doctor, usually Indian women are vitamin D3 deficient.
You can actually. I don't see any harm in that. You can just, it's a 60,000 international unit tablet, which you can take weekly once for 4 weeks. I tell my patients, take it like twice in a year. So take it in January, take it in June.
Yeah. Nice. Okay. Setu has asked, with irregular periods, it's difficult to track ovulation. So how do you suggest to maintain the track of ovulation? Is it like first regularize periods and try to conceive? Like, does it work like that?
See, for irregular periods, you need to know what the pathology is behind it. What is the exact cause? Is it hypothyroidism? Is it thyroid issues? Or is it polycystic ovaries? Or is there any other cause to it? So once you get to know that, you have to correct it. Only then, and at least if we get to know your cycle, like say if you get your periods within 45 days, we will be able to give you an idea of when you'll be probably ovulating. Otherwise, it's very difficult to do it, and only with ovulation tracking and medication can we find out when you're ovulating. So get it corrected first, or at least take the treatment towards that side and then go ahead. Don't blindly try if you have irregular cycles, because it'll be a very, what do you say, it's very emotionally, mentally, and physically straining. So you'll get very irritated while you're trying, and you don't want 2-3 months of that stress.
Right. So, say if I'm having OCPs and I'm trying for pregnancy, as in like you have a 21 days, I just found out my thing. Like they give the 21-day cycle and
You
this.
cannot try for pregnancy if you're on OCP. If you're on OCP, you don't want a pregnancy. That will not happen.
I
But
found a mistake
sometimes,
as soon as I said it. So yeah.
no, but sometimes what happens is patients who are, they feel this is, I've seen patients with this. So what they do is they have sex during the ovulation period, and then they feel that I'll take the OCP, I will not get pregnant. It doesn't work like that. So what they do, they take the tablet. Now you're taking estrogen and progesterone. So if you get pregnant, this is going to support it. So
Right.
you will not get your period, you will be pregnant, but you are thinking that I won't get pregnant. So yeah.
Got it.
Good evening, ma'am.
Yeah,
Actually, I've been trying to conceive for last 1 year, and I was put on folic acid, full weight MD,
Okay.
and I'm taking it for almost a year now. So is it safe, or should I stop?
No. See, folic acid, folate as such is there in all your greens that you're having. So it's a normal part of our diet. And folic acid, why we give you is that we're just preparing your body for a pregnancy. And when the pregnancy happens, it will support and help the development of the baby's nervous system, basically. So there's no harm in taking it at all.
Thank you.
Yeah, welcome.
Okay. Thank you, Priyanka. I have a few more questions. So periods stopped during COVID twice and a lot of weakness post that. Hemoglobin went down to 9. Period flow is low. What can be the steps to treat this?
Okay. See, actually, by all the studies, there's no major relation between COVID and menstrual cycles. But I have seen many patients who, have had some kind of problem with their cycle after COVID. So the thing now is that, okay, if you're having a low flow, one is your hemoglobin is less, you should get that treated, because it's not only your period issue, it's your overall health. So a normal hemoglobin should be more than 11, even though 12 is what we say, at least more than 11 for women would be good for you. So you can start off with iron supplementations along with a diet rich in iron. Apart from that, for your period, if it's still that way after a month of correcting your hemoglobin, get checked for thyroid problems, prolactin problems, and your scanning.
Okay. Doctor, if it's getting late for you, let me know, because the questions keep on coming. So.
I'll do one thing. I'll answer them as I read it.
Yeah.
So Prachi is like, when to do a UPT in PCOS. Now you cannot do a UPT in PCOS unless your periods are a little regular. So you can't keep blindly doing it. So get that checked, get it treated, at least get your cycle once in 40 days so you can assess exactly how many days you've missed your cycle, and then you can do your test after 1 week of missing your cycle. Megha is like, I have 35 days cycle on an average. What would be the most fertile days? Again, I said, you divide 35 by 3 and take the first half, middle half. Middle half is your fertile period. Shreya is like, can you please share the insights of getting mentally prepared for a pregnancy? That is very, very the best question right here, right now, because when patients come and ask me, ma'am, am I okay to get pregnant? It is not a physical thing is important, but right now in this era, I think the husband as well as the wife have to be mentally prepared to be parents, because it's not easy. The journey of pregnancy is not easy. Post that is not easy, because I don't know how it's become complicated over the years. Olden generation, they used to keep having children and one used to look after the other and things used to go. Nowadays, parents are overprotective, and it happens. It's happened to me. I know people with it. Everything needs to be done in a certain way. So think about it. Only when both of y'all are mentally prepared, physically, financially, emotionally, spiritually, then go ahead for a pregnancy. Yeah. And Harshita, are the doctor prescribed hormonal pills safe to take Definitely. Only doctors can prescribe hormonal pills, and they are safe unless you have any complications like any, we have complications like varicose veins with thromboembolism, or if you're a smoker and you want to take OCP. So these kind of things you should tell your doctor, because I've had patients not tell me, but only on me asking them or probing them, they'll be like, yes, doctor, I have a smoker too. That is something that you should definitely tell your doctor, because that can cause other complications that you don't want. So yes, they're safe otherwise.
Right. One question or last question, we'll wind up after this. So when you have OCP, I see a lot of them coming with a lot of gut related issues. Is there like, do you have certain things which has lesser gut issues, or this will give lesser effects or something like that? Like when we have iron tablet, there is certain things that does give lesser gut issues, right? So does that thought process work for OCPs as well?
See, the problem with PCO, if you're considering only PCO, polycystic ovaries and OCPs, you give a patient with PCO any probable extra medication, they will have gut-related issues. That is one thing. There is some level of, you can say like an inflammatory bowel thing in almost all PCO patients. That is one. Apart from that, yes, OCPs have different strengths and we give different strengths to different patients. So the lower strength OCPs are the ones which are much more acceptable and have lesser gut-related problems.
Right. Okay. Thank you so much, doctor. That was very
Thank
insightful. Even I learned a lot. Enjoyed this
I'm glad.
so much.
Yes.
Hopefully we can do more and more sessions like this. Have a good day. Thank you so much. Thanks
Thank
everyone
you
for joining.
Bye-bye.
Bye.